Do you have pain on the front of your knee and you're wondering what may be going on? Or maybe you've already seen the doctor and you've been diagnosed with Chondromalacia Patella, but you're not exactly sure what that is or what you can do about it? Then today's video is for you. Today we're going to be talking about Chondromalacia Patella, which is pain on the anterior aspect or the front of your knee, and also giving you some ideas on what you can do about it. Here we go. Chondromalacia patella is a breakdown in the cartilage that is underneath the patella. The patella is the kneecap, and on the underside of it, so the part that you're not able to touch, is what's called cartilage. And cartilage acts like a shock absorber. So it helps to transfer the forces from the kneecap to the femur, and specifically in regards to the quadricep, which is the muscle that it is sitting in. What happens is if your quadriceps or the muscles on the front of your thigh get too tight, or if you do certain activities, it can cause that patella or that kneecap to squish against that femur, which causes that shock absorber to kind of wear out a little bit over time. Now remember, every tissue in our body is designed to be able to heal itself as long as things are moving correctly, which means in this case for cartilage, you need some compression, some decompression, and you need it to be able to glide. So commonly people who have this problem, their patella or their kneecap does not move correctly. Who gets Chondromalacia patella? Oftentimes what we see is people who have this problem, it's usually an overuse injury. So it's either someone who does a high level of sports that involves a lot of pivots and stops and running and things like that, that just causes an overuse in that area, or people who are regularly doing activities like climbing ladders and different things like that, which really cause that knee to get through that range of motion. Now, we don't usually see it in people like bike riders, even though they do have that repetitive motion of the knee. It is actually the motion that actually heals that shock absorber or that cartilage. So bike riding is actually fantastic for people with Chondromalacia patella, but you definitely want to be careful with any of those higher level activities like jumping, stopping quickly, or pivoting. Of course, Chondromalacia patella can also be caused by a trauma. So if you fall on your knees, if you have any kind of like a car accident where your knees run into the dashboard, anything like that, any direct trauma to the knee can also cause Chondromalacia patella. It's often seen when people have an overuse of their quadriceps, even with daily activity, or if their quadriceps are tight. So if the muscle in the front of your thigh is tight, then every time you're trying to use it, it's causing that compression of that kneecap against the femur, and that shock absorber is just kind of getting worn out. Another group of people who may be having a struggle with Chondromalacia patella is if you have flat feet and you are using shoes regularly that are not super supportive. So like flip-flops or slippers or just something that doesn't have a good arch support. Especially as we age over time, if you have flat feet and you're doing especially any activities like running or even walking for long distances, what happens is the ankles kind of turn a little bit, and that puts more pressure from the shin bone into the leg bone, which also will put more compression from the patella or the kneecap onto that leg bone. So if you have flat feet, and especially if you're on your feet all day, or if your activities include walking or running, you want to make sure that you have a good supportive pair of shoes to make sure that you're well supported while you're doing your activity. Cautionary note on that though, if you have not worn supportive shoes for a long time or ever in your life, even if you've been walking or running for a long period of time, don't necessarily go with the max support. So I've heard many stories of people who have flat feet, but they don't realize it until they get older and they start having some kind of problem. So they finally go to the running store or the walking store to get fitted for a pair of shoes. Of course, the people who are watching them walk are like, oh, you have flat feet, so you need to be super well supported. But if you're going from no support to max support, that can cause other problems. So if you haven't been wearing really supportive shoes, or maybe you kind of wear your shoes even when they're dead, or your feet are not used to that level of support, make sure you start with more of a moderate support range and work into that max support if you need it. You only want to provide the amount of support that your body needs to keep doing what it wants to do, pain-free. Now, what are the signs and symptoms of a chondromalacia patella? So if you're wondering if this is what you have, then this part's for you. So what will happen with chondromalacia patella is that you will get pain after you've been sitting for a prolonged period of time. Usually when people are being active and keeping things moving, everything's kind of staying at least a little bit hydrated and you don't have any problems. But people with chondromalacia patella really struggle with pain after sitting for longer periods of time. Now, for you, that may be 30 minutes, for you, that may be 2 hours. But if you have pain after sitting, increased knee pain, then you probably do have chondromalacia patella. A couple of other signs is that when you're getting out of the chair, so you've been sitting for a while and you're getting out of a chair, then that will usually cause that compression of that kneecap on the femur, and that will be really, really painful. Going up and down stairs, because again, as you go up or down, you're using your quads either way, that will be definitely a sign of chondromalacia patella. And if you're kneeling or squatting, especially with your knees on the ground, putting that compression again through that kneecap onto that femur is going to be really, really painful. But even if you're squatting down and your knees aren't on the ground, because you're in that full end range flexion position of the knee, that's usually painful too. So those are the signs that you want to look for. And if you've noticed that maybe you have one or two, but not all of these, that's fantastic, because that means you're in the earlier stages and you definitely want to take care of this now before it gets any worse. So what can you do to treat chondromalacia patella? Well, the first thing I want you to be doing is to be icing regularly throughout the day. So depending on where your symptoms are, you want to be icing at least 3 to 5 times per day. When you're icing, you only need to ice for 5 minutes. The research shows you get the max benefit from ice after 5 minutes, and I know it can be difficult to create periods of time throughout your day to ice. So 5 minutes, ice it 3 to 5 times per day. You don't necessarily need to be sedentary while you're doing this. I'm perfectly fine with you taking an ace bandage, wrapping up an ice pack on your knee, and going about what you need to do. That's absolutely fine. It's getting the ice on the knee that is going to be the most helpful thing. The other thing we want to be doing is we want to be stretching the quadriceps and the IT band, which is on the side of the leg, to make sure that we're not getting that abnormal compression through that kneecap. So you want to be stretching those guys, and we want to be strengthening the VMO. So that is one head of the quadriceps, which is the muscle that's on the front of the thigh. It's the vastus medialis oblique, and it's the one that helps to keep the patella tracking correctly. A lot of people struggle with this, especially if your hips are weak, or if you do a lot of running and your hips are weak. They'll have that increased force through the middle aspect or the medial aspect of the knee, and then that can cause the VMO to get weak. So you want to do some exercises to strengthen the VMO. We have an idea of an exercise here that we'll link in the video below. That's really great for helping to get that VMO more active. Of course, you want to balance rest and activity. So obviously, if you have pain with sitting, you don't want to be sitting for prolonged periods of time, but probably walking and biking and doing things all the time is probably not realistic with your lifestyle, but also not realistic for your healing. You do need to make sure you have appropriate times of rest and have that balance between good activities that are good for your knee and rest to make sure your knee has time to heal. So finding that right balance for you is really, really important, because your body needs time. It does need some rest in order to be able to heal. But that doesn't mean weeks, right? It's periods of rest throughout the day. So let's say you work from a desk and you have this problem, you have the chondromalacia patella, and you're like, I have pain with sitting, but I feel like I can't stand all day either, because then my knees will start bothering me. So if that's your situation, then what you want to be doing is sitting for a half hour, standing for a half hour, sitting for a half hour, standing for a half hour. So hopefully you have the automatic up and down on your desk, because it's going to need to change a lot. We don't want you sitting for long periods of time, but obviously we don't want you standing for long periods of time, because we do need those periods of rest. If you do work at a desk and you're going to be sitting and standing, I would recommend icing when you're sitting. Again, you can use that ACE bandage to wrap that ice pack around, not a problem at all, but that should help you get in 3 to 5 times per day. You need to maintain a healthy weight, because having excess weight that we're carrying around puts more stress through that knee joint, which puts more pressure on that patella or that kneecap. So really important to watch your weight and maintain that, so we can decrease stress on the knee so we don't have as much pain. Now, a lot of people ask me, will taping my knee help? And it may help temporarily. It is a Band-Aid technique, and sometimes Band-Aids are helpful, right? Sometimes you just need a Band-Aid to get you through. What I recommend is, if you need taping in order to be able to sleep, or in order to be able to do your activity because the kneecap's just really messed up right now, then I have no problem with using tape, but it shouldn't be your long-term go-to strategy. It should be, again, a Band-Aid technique, something you use when things are really bad, but not necessarily something you use all the time, because it doesn't actually change the tissue. What the tape does is it helps improve the mobility of the joint for a short period of time, as long as the tape lasts. But what we really want to do is stretch the appropriate muscles, strengthen the other muscles, so that you don't have this problem bothering you in the future. Just understand when a Band-Aid can be helpful. What questions do you have about Chondromalacia Patella? Drop them in the comments below, and we'll be happy to make a video about it. Have a great day, everyone.